Hi everyone, Equestrian SPT here. I haven't done a vlog in a while, so I figured that I would catch you guys up on everything that's been happening this semester.
So I'm just taking a walk. It's Friday afternoon, and so I am just kind of letting loose a little bit and just enjoying this beautiful summer weather. Okay, so I'm going to talk a little bit about what's been happening. And since I have just finished the 6th week of the musculoskeletal or orthopedic semester, and it's been a whirlwind. I just finished my first set of exams that happened on Monday and Tuesday. So a lot of studying was put into that. So we had our written exam on Monday, and then we had our clinical lab exam on Tuesday. So basically the exam consisted of the lower extremity. So we did the knee, the hip, and the ankle. And so the written exam had questions on all 3 of those joints. And then our clinical exam, which was actually, I think, a really good preparation for the clinic, was they gave us 9 scenarios in advance, and then we had to go in and perform 3 special tests. Special tests are kind of things to help rule in or out a diagnosis depending on how the patient responds to the test. And so we had to do 3 of those. And then we had to do some joint mobilizations, which can be used for different purposes. So it can help with increasing the motion of a certain joint, or it can help with pain relief. So depending on what the goal is of the treatment session. And then we had to do 2 exercises specific for the case that we had. And then we had to do a pre-exam, fill out some questions about what we were going to do, and then post questions about why we did it. And then it asked us, like, if you had more time, what other tests would you have done? Which I think was a really good way for us to put our skills into action, and then also just combine everything. And it's similar to something that we would do in an eval. Might be more complex than the cases that we were getting. Some of the cases we had were knee pain, ankle pain, hip osteoarthritis, hamstring strain. So pretty basic cases for us at this point, but I know it's going to get more complicated, so I'm not really too worried about it at all. And I'm actually pretty grateful that they weren't too complicated. So that was the exam. Another thing that's been happening is we have been doing mentor labs, which have happened over the last 6 weeks. And I've had the same mentor for the first 3 weeks. And then I had another mentor for the second 3 weeks. And basically what we would do is go through case studies on a couple of those mini cases at the end of the unit, and go through tests for that joint. So we practice our hip stuff, we practiced our knee stuff and our ankle stuff, and it was great because it gave us a lot of individual feedback. And the second year class is very knowledgeable. They're a great class, so grateful to have them and their wisdom, because it's just really hard sometimes when you're in lab learning these special tests with a lot of different hand placements. It's really hard to get the individual attention that you need to actually learn the tests. So it's nice to have someone in the moment telling you need more pressure, or move your hand to another side, or you can hit me harder, which sounds weird. There's one test called the bump test, and you hit it the bottom of the foot. It's to look for a stress fracture. But anyways, I don't like that test because I don't like hitting. I just don't like that. So she's like, you've got to do it or otherwise you're not going to provoke the symptoms. So anyways, it's all like little things like that that I have been working on in the mentor lab. So I've been really grateful to have their mentorship. And so that's been for the last 6 weeks. Unfortunately, they are going on well, not unfortunately. Fortunate for them, unfortunate for us as the first years. They are going to be going out on clinical, and so we will not be able to work with them anymore. So I'm a little curious to see how that works out with learning all of the tests, but I'm sure we'll make it work and just have to practice more on our own. So another thing that has been happening is that I have been trying to study more of the information before going into lab. Sometimes it works, sometimes it doesn't. There's only so much prep you can do before actually going in and actually performing the skills. That makes it a little difficult. So, but it's the best we can do. So another thing that we have been doing this semester is having our lectures, and we actually have had a few very interesting ones. We had an orthopedic surgeon come and talk to us about knee injuries, which was super cool. And then we had one of our professors come and talk to us today about pain, and pain is just so complex. It's way more complex than a lot of people think, and we barely were scratching the surface on it. Ha, ha, ha. That's bad, but anyway, sorry for people who got that. Go you. And so far, it's been a pretty good semester. I've been learning so much, and my brain doesn't feel like it can handle anything else. But I still have to finish learning the upper extremity and the spine. So follow me in the future, and I will let you know how all of that stuff goes. So right now I'm taking a walk on my favorite trail, and it is so beautiful out today. I just love this trail so much.